Good afternoon, good afternoon, good evening. Welcome to the makeup class on substance use and mental health. Um, Thank you for joining. Okay, I'm glad to have you. We're supposed to have this class earlier, but because of unavoidable circumstances, we have to do this makeup. So let's get on with it. Good. So, week by week, we've been going through the course mental health and illness. And in this week 9, we're going to look at substance use and mental health. Let me just, organize my settings. Thank you so much. Okay, let's get on with it. So, substance use and mental health. Here, basically, we are focusing on a relationship that may not necessarily be from both sides at any given time. But the use of substances can eventually affect mental health or ill health, and mental ill health actually can affect or can influence the consumption of substances in order to be able to cope. So that relationship is what we're going to delve into and see what positions we can take, especially from a postgraduate level, as those now in managerial positions, leadership positions, decision making roles, those having the ability to make decisions, and even deciding, being decisive on our own within the society, realizing the problems that exist, to take action and then make decisions to be able to assist those with substance abuse problems that lead to mental ill health, and those with mental um, health problems as a result of substance abuse. So, in this case, we really want to get into the practical aspect of being able to address matters on the ground as regards to substance use and mental health. So, let's get on to it. So, in terms of introduction, we're just introducing the basic concepts, and we're saying that substance use and mental health are interrelated or are connected, are intertwined. Now, some people may use substances to cope with mental distress. Okay, so maybe stress, for example. Some people may use substances to cope with stress. Others could develop mental issues as a consequence of the use of substances. So, somebody who doesn't have any history of mental illness but consumes substances, let's say a legal substance like alcohol on a social basis, but ends up developing mental illness as a result of that, maybe through continuous use or an increase in the uptake outside the recommended requirement, or what is recommended as regards to biological health, okay, in terms of consumption per day or per sitting. So we need to understand, therefore, this relationship, and this is a bi-directional relationship. Yeah. And this relationship will help us when we are conducting our assessments. We'll be able to critically conduct effective assessments. We'll be able to give up the right interventions, and we'll be able to influence policies effectively or formulate policies effectively. All right. Now, having said that, we need to understand or be in agreement on what substance use is. This is the consumption of alcohol, tobacco, or other drugs, including prescribed or illicit substances. Then we have substance use disorder, SUD. This is a condition that is characterized by an uncontrollable desire to use a substance despite the negative consequences. One of the latest that we have in our society today is vaping. Okay, you see vaping commonly occurring. People are finding Some people are finding vaping as an alternative to smoking traditional cigarettes, perhaps looks a bit fancier, um, or cleaner, doesn't retain the smell. But now, in terms of the health consequences, a lot of research is still being done on that. But yes, um, connecting this to use of substances because of an uncontrollable desire to use. Okay. And of course, that would apply to many other substances like alcohol and cigarettes and others. Dual diagnosis is the co occurrence of mental health disorder and substance use disorder in the same individuals. Individual, sorry. It's like having a number of possessions in terms of spirits, like demon possessed by two, one mental health demon and one substance use demon. Very heavy. So let's look at the connection now between these two, okay, between these two possessions, mental health and substance use. All right. So we have mental illness leading to substance use. That is one side of um, um, the bench. Okay, mental illness that then leads to substance use. So individuals may self medicate when they feel symptoms of depression, when they experience anxiety, uh, when they experience symptoms of post traumatic stress disorder, psychosis, or others. For example, you have a person who is not diagnosed or undiagnosed, but experiences symptoms of depression. And so they may turn to alcohol, okay, to alleviate the emotional pain, to give them that lift. So in this case, you have mental illness leading to substance abuse. On the other hand, or on the other side of the bench, we have substance use triggering mental illness. So now, chronic substance use, okay? So chronically using substance use, of course, this will lead to changes, chemical changes in the brain, okay? Alcohol will alter the brain chemically, or alters the brain chemically, definite, okay? There's no cause without consequence because of the natural balance of life, positive and negative, that nature abhors vacuum, that if you remove on one side of the bench, you need to replace on the other side of the bench to maintain the equilibrium, the balance. Cause must have consequence. And so the chronic use of these substances will alter the brain chemically over a period of time, depending on the intensity of the use and the frequency of the use. And this could manifest as mental illness. For example, long term cannabis use has been linked to the onset of schizophrenia in those who are genetically vulnerable, right? Talking of cannabis, some of the symptoms or experiences that occur in the consumption of cannabis include experiencing hallucinations, which are also experienced in mental illness like schizophrenia. So, continuous consumption of cannabis exposing one to hallucinations, and frequency in hallucinations then exhibit similar occurrences or symptoms to somebody experiencing schizophrenia. Okay, so you begin to see the connections. Um, Withdrawal symptoms, let's say in alcohol after the heights, the withdrawal symptoms, if perpetuated, so you have frequent drinking and increased consumption, Therefore, the withdrawals become harsher. And symptoms similar to depression are experienced at withdrawal. Depression, basically, somebody gets really depressed. And if this is perpetuated, then you can see that becomes a long-term pattern leading to some sort of permanence of the occurrence of depression, which could be diagnosed as actual depression. Okay. All right. So, what are the shared risk factors for both? Okay. For both, trauma can trigger the use of substances. Experiences of trauma will trigger the use of substances, and will also can also trigger mental illness. Poverty comes with it's such a big terminology. Poverty, it's so loaded, but the harshness, the difficulties, the torture, that comes, that is packaged within poverty. Okay, all those experiences can lead to substance abuse for substance use, and then abuse for comfort, and mental illness, just the inability to deal with all that overwhelm. Genetic predisposition, yes, some people could be genetically predisposed to mental illness, and we've talked about this in previous classes, and or could be genetically predisposed to the use of substances. Yeah, because it's substances that are commonly or frequently or intensely used within a family, within an extended family, within a clan, within a community, within a society, become kind of like second nature, like alcohol, because of its legality. Second nature, therefore, eventually, as the generations move on to, because of the altering in the brain, the chemical altering in the brain could then be adopted biologically and then be genetically passed on from one generation to another, right? Because of the availability, the proximity to the substance. Social isolation, of course, is a factor that influences mental illness, and is also a factor that could lead to substance use. Peer influence, again, influences substance use, and likewise might affect mental illness. Okay, in this regard, as to the activities, for example, that peers partake in, all right, activities that then lead to the occurrence of the symptoms of mental illness and eventually to mental illness. All right. So, like again, with a legal substance like alcohol or with a legal substance like tobacco. Okay. And in instances where marijuana, for example, is legally consumed, mira, and so on and so forth. All right. So some of the commonly used substances are alcohol, is top of the list, and its effects on mental health include depression after the high, anxiety, particularly towards consumption, looking forward to the consumption, aggression during and after, shortly after, or sometime after consumption, memory issues, to just be able to deal with the repercussions of the effects of things like aggression, which happens during the consumption. So memory loss or memory issues to, in other words, delete what the client will have engaged in during the consumption of the alcohol in a bid to psychologically run away from the responsibility of action. Okay. Then we have cannabis, marijuana. Effects include psychosis, acting extra high during consumption, particularly when consumed along with other drugs, paranoia, which includes hallucinations, and eventually cognitive impairment. For example, like loss of memory, loss of retention of information. We have cocaine, which causes anxiety towards consumption in a bid to push for consumption, hallucinations during consumption, and shortly after consumption, and mania as effects of consumption, craziness, increased awareness, kind of popping out of eyes, and so on and so forth. Heroin. Effects include depression, post-consumption, dependence on the drug, withdrawal stress, okay, making the client get restless in a bid to, as they are trying to look for their next high, which will involve also activities like stealing in order to financially support access to the drug. Cat or mirror. The effects include insomnia, commonly used by truck drivers and those who work at night, who want to keep awake. So during consumption, people are able to stay awake. But after effects also, when not needed, let's say when not using it for work, the insomnia persists or could persist. Anxiety and irritability too, so anger issues and similar. Glue on or inhalants, these affect cognition, they result in cognitive damage, hallucinations, emotional numbness, among others. So these effects are also similar to the effects or the symptoms that are experienced by clients who have or are facing mental illness. And so during diagnosis, it is critical to look at these two aspects. When you have a client who is having a mental disorder but also consumes substances. So we have an example here in Butere, Kakamega County, whereby a community outreach program identified glue sniffing among street-involved youth as a contributor to hallucinations and aggressive behavior in the town. Okay. Let's look at populations that are vulnerable to substance use and mental illness. We have adolescents and young adults, maybe as they try to discover themselves. Young adults could be dealing with, looking for work, looking for meaning in life, their expectations of life being thwarted. various personal challenges, among others, persons with mental illness themselves, internally displaced persons due to various security issues, including post-election violence, people living with HIV and AIDS and other terminal illnesses, and then those working in the informal sector, perhaps dealing with job security issues, among other challenges within the sector. So an insight here is that particularly among truck drivers, long distance truck drivers and commercial sex workers, there's been a surge in drug use. And this has also been accompanied with increases in depression and risky behavior. Let's look at the social and economic impact of co-occurring disorders. So we're talking about mental illness and substance use. So for example, in the issue of the example of long distance truck drivers and commercial sex workers, where we have discovered a surge in drug use, and where there is also an increase in depression and risky behavior. Some of the impacts we'll see include increased healthcare costs for them, breakdown of their families, loss in their productivity in terms of their business or employment, legal issues, which sometimes lead to incarceration, and stigma and marginalization from society. So let's look at some of the treatment or approaches to treatment and the interventions that we can give where these factors coexist. So we have integrated treatment, which is key because we're dealing with the double factors. So in this case, we combine mental health and substance abuse treatment into one coordinated approach. Okay, and this is usually more effective than parallel treatment, whereby a client goes first for mental health treatment, and then at another given time, they go for substance use treatment. So, for example, a client who is receiving both cognitive behavioral therapy for anxiety and at the same time, group therapy for alcohol dependence. That would be most effective. Then we also have harm reduction strategies. These are used when, particularly, you cannot totally withdraw the substance that is at play. You know, like somebody is highly intoxicated, or their addiction levels are, the depth of their addiction is significant. And so to suddenly or totally remove the drug would shock their systems. And so in this case, we withdraw them safely and gently, okay, in order to reduce harm on their system. So this encourages safer use, okay? The substances are allowed, but in a safer way, because it is not immediately achievable for them to abstain from the substance use. So this includes needle exchange programs, supervised consumption sites, and methadone programs to enable us to use in reduction as we slowly do away with the use of the substance. Then we have rehabilitation, and community support. So in this case, we have residential rehabilitation, or we can have outpatient programs. Okay, it's not all in all cases where we can admit. Okay, uh, we can do detoxing of the system, um, therapy, provide life skills. Okay, and many other interventions. And we also have, we can also use community-based support systems like Alcoholics Anonymous and family involvement. So what is our role as social workers? Remember, we are looking at use of substances and mental illness occurring at the same time. So the dual disorders, motivational interviewing, and counseling. Okay, you can imagine how having the two issues critically at once. And so the interviewing should be motivational in that it is encouraging to the client um, of the possibilities of improvement. Counseling, of course, advocacy, advocating for the client in terms of access to mental health and substance use services, sorry, especially when this is out of reach for them. Educating the family or families in the community and supporting them. And remember, in the previous class, we talked extensively about the role that the family plays in maintaining mental health, and also can play in driving towards mental illness. So family is very important. And then reintegration of the client back to society, let's say after they've left rehab, or even a mental institution, um, which is part of rehabilitation, and including prison. And prevention of relapse, okay? Planning for prevention of relapse. Okay, so for example, we have the Richard Center Trust in Nairobi, which runs harm reduction programs and includes social workers as peer educators and family liaison officers. Now, it is best to always practice under legal frameworks, because legal frameworks gives us the basis for practice. So within our country, we have the NACADA Act of 2012, which regulates drug control and promotes public awareness. So using the NACADA Act, when we do like community outreach, for example, we know that we are acting based on the NACADA Act, based on law. We have the Mental Health Act of 2022, which supports integrated care approaches. We have the Penal Code. Now, the Penal Code criminalizes possession of illegal substances, which is important. Though this also poses barriers to rehabilitation because of the connection of the possession of illegal substances to criminal activity. Um, in some societies, marijuana, for example, in small quantities is legally accepted, okay, particularly for treatment of some terminal illnesses like cancer, okay. Sometimes in some societies, it is also practiced that having some of these substances in smaller quantities will reduce the excitement there is about them and generally drop the desire, okay, for the masses to go after them, because after all, they are available. Okay, so when you remove the criminalization of them, not totally, but in a reasonable manner, then the thirst for them goes down. Okay, is controlled. So this is part of rehabilitation. Okay. So when it comes to the advocacy that we've been carrying out, we are seeking a more health centered rather than a punitive approach. And that's why we're talking about looking at ways of integrating some of these, integrating the acceptance of some of these substances in society to reduce the hype about them. Okay. The challenges in addressing substance abuse and mental health. um, we have limited access to dual diagnosis services. So, like a professional that is honed in diagnosis of both, institutions or centers that are specialized in provision of services for both, right? The stigma that is associated with just substance use and mental illness, dropout rates in treatment, lack of trained personnel, again, like we said, in the integrated care that we are pushing for, and then the criminalization of drug users. We've already talked of that. So you can then, we'll go through these classroom activities, but you can then, in your groups, be able to have these discussions for practice, because these then bring out the skills that are required or that would enhance practice. So here we have, for this case study, a 22-year-old university student who begins using alcohol excessively after losing both parents in an accident. She starts failing in class and becomes socially withdrawn. How would you assess and intervene? Okay, so you can do this in your groups, discuss this, and then do a report on the same. Here we have a topic for presentation. Design a dual diagnosis treatment program suitable for a county, so in this case, you'll choose any county of your choice, suitable for, sorry, a county mental health facility. All right. So in summary, substance use and mental health often co-occur and therefore require integrated treatment. The risk factors include poverty, trauma, and peer pressure, and these must be addressed holistically. As social workers, you play a key role in early identification, in counseling, in family involvement, and reintegration support. Kenya's policy environment is evolving, but still faces significant implementation gaps. And it is these gaps, when I connect back to where we started from at the beginning of the class, at this level of study, it is these gaps that we intend for you to fill. And so begin to think in terms of rehabs that provide integration services, enhancement of interventions in these rehabs. Okay. Support, okay, community support, particularly family centered support, family education, okay, provision of family education, and setting up organizations, we could say, or bodies that can provide these kind of education to families and communities and to different institutions, okay, on these duality of substance use and mental health. And like I said also earlier, um, increase, okay, because we have an insufficient supply or insufficient existence of rehabilitation programs and organizations. So for yourself, to encourage you, for yourself to be part of those who will form rehabilitation centers around the country. Okay. I have listed some readings here for your use, which you can refer to. You can access this from the library um, through the online services in the library or physically in the library. Okay. So thank you. And then we'll meet for the next class of week 10.